Thank you, April. We'll get the slides up here. At first I really want to thank you all for being here this morning. When you schedule a day-long meeting on a Sunday, a beautiful Sunday in Washington, and you really begin to separate who's serious, perhaps pathologically so, from the rest. So we know that you're serious, and we have people here who can help with that. I'm just going to give a brief update on the progress we've made recently, some of the recent achievements of Knowledge Network, and then I'm going to set us up for the conversation today where we're going. One highlight as we look back over the past several months is we actually hosted a session here in this hotel, I think actually across the hall, for the mHealth Summit, which is the largest meeting for mobile technologies and mobile healthcare on mental health. And this was a nice opportunity for us. A couple of years ago, I had attended the mHealth Summit, and there was an interest session on mental health at that meeting. It was also at 8 o'clock. I think it was actually 7 o'clock in the morning. So it was really those people who were really serious. And the people who were interested in mental health at that conference who were willing to get up at 7 a.m., we could fit around a table, one of these tables in this room. So at this, we had, filled up the room, very well attended, lots of interest. We had some great partners, David Alward, who's talked to us, David Chambers, who's been a good supporter of our work over the years, Tom Herzog from NetSmart came, and also David Moore from Northwestern spoke. And then we actually hosted a roundtable, and that I was worried about because that was after the conference actually officially ended. And it was kind of mid-afternoon. People are usually packing their bags and leaving during the last session and heading out. And we had an even larger crowd for that. And that was really an engaging discussion around where we could go with using mobile technologies in the mental health arena. So I think we've hit that tipping point, that inflection point, and really thinking about the rest of the larger healthcare community is beginning to get excited about what mental health can offer as part of whole health. And that work has been folded into our implementation work group. So now we're having some discussions there. We had a great Hill Day early in the spring. It was actually the day of the State of the Union, which I have to say was freezing in Washington that day. But lots of good success. Of course, we've had the great milestone with the Excellence of Mental Health Act and the pilot funding there, and have been, very aligned with National Council's great efforts along those lines. Our implementation group has been doing good work. Kara Lewis, in partnership with the Seattle Implementation Research Collaborative, is putting together a framework for implementation of evidence-based practices in the community. On the data warehouse, that continues to grow. We now have about 20 states represented, 600,000 clients, 34 million service records, 4 million medication records, and 2 million diagnosis records. This has really benefited from our relationship with NetSmart, where we've partnered to be able to take it out to an even broader, using their network and infrastructure and relationships to take it out to an even larger audience nationally. And we're working to try to begin to bring that data back in to leverage for research. So I want to thank NetSmart in particular for that partnership. But our relationships continue to grow nationally. If you begin to look at where we fit in relative to the largest cities in the country, you can see us there in orange. Not so bad. I think that's number 61 nationally if you look at it in terms of cities. So, and it's the largest warehouse of this kind of information we're aware of in the United States. We've also put together a research advisory committee. Many of these are people who have talked at Knowledge Network before that you know. Ben Druss with Emory, Jeff Hammerbacher with Mount Sinai and Cloudera, Neil Jordan at Northwestern, Jason Llewellyn from CRI, David Meltzer from University of Chicago, Deb Scharf from RAND, and Michelle Tomlinson from the Hope Institute in Michigan. We've been working with that group to say, how do we begin to leverage? We built this wonderful asset for mental health research and policy. How do we really begin to leverage that in terms of mental health services research? We also had a conversation in the fall with Tom Insel and Philip Wang from NIMH. And, it was interesting. They were both unaware of this work and the data that was available. Very, very excited about it. And they said, what we really would like to see you do is come back with, the NIMH researchers and make it available. So we did. Actually, just a few weeks ago, they had their Mental Health Services Research Conference, and this is John Putz from CRI here. And we, went there and did basically a technology demonstration on site there, where researchers who were at the conference, and this is a specialty conference for people who do mental health services research, a very niche field really, but this is exactly the audience that we want to reach. Very excited about what this data could mean for the industry. So that's a look back. Looking forward, I really want to talk about where we're going in this industry, and I think we're at a unique inflection point that is pretty unique. And this picture here at the bottom, this is the Eastman Kodak plant in my old hometown of Kingsport, Tennessee. So my dad worked there. He was an engineer, and his dad worked there. It's hard to talk about in a way. And I remember one of my earliest memories was we had, I was probably 4 or 5 years old. This was probably 1972. And I remember we had one car as a family, and my mom would drive my dad to work sometimes, and I'd sit in the back seat with them, and we'd go in this plant, and you could see the webs of train tracks and different things going on. I'd see the trains there, and I thought my dad drove the train because he was the engineer. I thought that was the coolest job that anybody could possibly have. Later I came to understand he was a chemical engineer, and I still have no idea what a chemical engineer does. But the interesting thing about the Kodak story, this was one of the iconic American brands, if you go back 30 and 40 years, and they owned many of the patents for digital film. And their engineers inside the company were saying, we need to move to digital. This is coming whether we like it or not. And the business side says, we've got a really good business in the film. We don't see a need to change. So they're really an industry that they saw the opportunity coming, they saw the change, and they really couldn't bring their way to transform themselves. And I think we're at a similar inflection point when you think about community mental health and all that's going on. First, we're doing great work. Recovery is real. We're changing lives every day. We're helping people every day. We're making a big difference. We're all here. We're all here today because we're committed, right? But if we look around us, a lot is changing. We see health reform. These are the topics we're going to be talking about today. We see cuts to mental health services, billions of dollars in cuts. Parity, the impact of parity. We have new technologies coming in that allow us to provide services and think about services in ways that we never could before. Pay for performance, outcomes. How are we going to use that data to improve what we do and get paid for it? The impact of different changes in our workforce. How do we use peers more effectively? How do we change and rethink and reimagine what we do? New paradigms of evidence-based practice. How do we really take what we know and implement it in practice? We've talked about a little bit at one of our previous conferences. I think we'll talk about it more in the future. The impact of the microbiome and nutrition, just a broader understanding of health and wellness. But a lot isn't working. We have people in our criminal justice system. Our criminal justice system is currently our, my wife is calling me, is currently our primary institution for people with mental illness in this country. That's a tragedy. That's a failure. Of all the successes we've had, that's something our system is missing. We're also showing up too much in the ER. Mental illness among homelessness is epidemic, and we know the problems that we have in our schools. This is just a chart showing the rise in institutionalization. Currently, we have more people in prison incarcerated in this country with mental illness than we ever had at the height of institutionalization. Our suicide rate is, a national problem. We're losing more people to suicide in the military than we're losing due to military action. We're going to talk about these topics today. And I just want to close with this. This is from an investment report that I'd be happy to share from a company called TripleTree. They basically look at different industries and assess the sort of the risks and opportunities from an institutional investor standpoint. And what they said about behavioral health care is they said today the behavioral health care market sits at an important inflection point. While the demand for mental health and substance abuse services is reaching unprecedented highs, the supply of services and providers across the behavioral health continuum is neither sufficient nor optimally aligned with the broader care continuum to drive improved outcomes at lower costs. They're talking about us, right? The behavioral health care landscape has evolved into a fragmented and often chaotic web of providers and delivery models that take a myopic view of treating specific conditions rather than a holistic view of the individual, who frequently suffers from several comorbid physical and mental health conditions. Given these rapidly evolving market dynamics, so we see that and we think, oh, well, that does sound familiar. That's a real problem. From an investor standpoint, they say there's an opportunity, right? And I think we have to begin to shift our thinking to seizing those opportunities for our industry. So given these rapidly evolving market dynamics, TripleTree believes the behavioral health market represents a highly compelling investment opportunity for both strategic and private equity investors. And we see that. We see lots of little startup companies, that never would have touched behavioral health in years past, with a focus on behavioral health now. I mean, they are coming. They're interested in, what has historically been our business that nobody else has been interested in. So I think the moral of that story is we have to really let go. If you look at other industries, if you think about Kodak, and we could name dozens of other examples of industries that have kind of missed the boat. They've seen this inflection point coming, and they haven't grabbed that moment. They've held on to the past because they were afraid of change. They didn't know how to get there. And really, that's what's in this room, is leaders who are thinking ahead about what that change can be and what we can do. And that's the agenda we put together today, is really intended to give you a little bit of that landscape and encourage a conversation that we can then take outside of this room and move forward to really change the industry, to make it a better environment for us.